I stay at work for you, you stay at home for us.
What are you saying?
This has been a very popular phrase on social media for quite some time now. It's to encourage people to stay home and be safe in view of the COVID-19 pandemic. But staying home for such a long time is making me restless.
I get you, but do you know that since the outbreak in March, the number of cases in the world as of mid-August is more than 20 million according to the Worldometer. I'm very grateful for being able to stay safely at home during this time, all thanks to our frontline heroes doing their jobs and keeping the rest of us safe.
I agree. Doctors, nurses, and all medical workers are taking high risks in order to provide the best care to their patients.
I remember when the outbreak first started, many hospitals had to adjust quickly to accommodate the surge of COVID-19 patients. With the lack of personal protective equipment throughout the country, medical workers have to be very brave.
What? They're literally putting their lives at risk.
It's true. In the Taiji Men website, Wayne Jar, an anesthesiologist, shared that the outbreak led to a surge of patients in the hospital. Those who needed surgeries at that time were at very high risk of being infected. Fortunately, he was given the Preventive Measures of Health and Well-Being brochure from Taiji Men, which talks about the 5 do's and 3 don'ts, and also learned about the 6 tips to stay safe and healthy. Not only was he feeling safer about his work environment, but he was also able to calm his patients too.
That is awesome. But my friend Brian, who also works in a hospital as a blood drawing technician, started coughing and had to quarantine for 10 days at home.
That's too bad. Did he get better?
Yep, he took a chest x-ray and confirmed that it was not COVID-19. During his quarantine, he followed his daily routine of practicing Qigong and was able to quickly recover from the cold.
That's great news.
Yes, but he was still a bit hesitant about going back to work, especially when he had been assigned to work directly with COVID-19 patients. Luckily, he was inspired by an ER nurse who overcame her own fears with good thoughts and positive energy and became more compassionate. Deeply inspired by her transformation, Brian decided to do the same. He is taking preventative measures to keep himself safe and feels empowered to encourage others at work. You mentioned earlier about the 5 do's and 3 don'ts, as well as the 6 tips to stay safe and healthy. What exactly are they?
The 5 do's are to wash your hands, drink more warm water, do more exercise, be happy, and be more careful. The 3 don'ts are don't lose your temper, don't worry, and don't be anxious. The other 6 tips are wash your hands frequently, wear a mask, practice social distancing, stay positive, refrain from touching your eyes, nose, and mouth, and enhance your lung capacity. And from 2 of our frontline heroes we heard today, the most powerful remedy is love and conscience.
I get it. Everyone is in this together, and if we can all learn to coexist with the virus and implement preventative measures into our lifestyles while following our conscience to do the right thing, we can keep ourselves and the world safe.
That's right. With love and conscience, each and every one of us can take part in helping the world. Not only do we have the tools to keep ourselves healthy, but we can also help each other get through these challenging times. When we all act upon our conscience, together we can overcome this crisis in no time.